The aorta is the main blood vessel in our body. It carries oxygen-rich blood from our heart to the rest of the body. An aortic aneurysm is a weak spot in the aorta that bulges or balloons outward. An aortic aneurysm is a serious medical condition. If the aneurysm ruptures or tears open, it can cause life-threatening bleeding inside the body. To understand how aneurysms form, it helps to know a little about our anatomy. The aorta has three main sections. The ascending aorta is the part that leaves our heart and creates a large arch as it curves back toward our spine. The thoracic aorta is the part that runs through our chest. The part of our aorta that starts near the kidneys and ends just before it divides is called the abdominal aorta. Normally, the wall of the aorta is thick and elastic, but certain things can cause a weak spot to form in the aortic wall. When the aortic wall is weakened, the pressure of the blood flowing through the arteries causes an aneurysm. Abdominal aortic aneurysms often don't have any symptoms, especially at first. If the aneurysm grows quickly, tears, or leaks, you may have some of these symptoms: sudden pain in your belly, groin, back, legs, or buttocks. Breathing problems or shortness of breath, nausea, and vomiting. Clammy, sweaty skin, throbbing or pulsing in your belly, dizziness, and rapid pulse. If you have any of these symptoms, call your healthcare provider right away. A split or rupturing abdominal aneurysm can cause a sudden, severe, sharp pain in your back, belly, or side. Most of the abdominal aortic aneurysms are asymptomatic and found incidentally during ultrasonography, abdominal CT scan, or MRI conducted for other reasons. Most abdominal aortic aneurysms do not present any symptoms until they rupture, although some are discovered during an assessment for stomach complaints. Symptomatic aneurysms, particularly those causing pain or tenderness on probing, are more likely to rupture. In rare cases, abdominal aortic aneurysms can lead to hemorrhagic and thrombotic complications, including embolization, thrombosis, and disseminated intravascular coagulation. An acute abdominal aortic aneurysm rupture is one of the most dramatic emergencies in medicine. Patients with ruptured abdominal aortic aneurysms usually present with shooting abdominal or back pain and pulsatile abdominal masses. The rupture of an aneurysm usually causes severe hypotension. In patients with ruptured abdominal aortic aneurysms, approximately 50% make it to the hospital alive. Of those who make it to the hospital, up to 50% do not make it through repair. Now, what causes these aneurysms to rupture? A lot of factors increase the risk of an aneurysm rupturing, including aneurysm size, expansion rate, and gender. First, aneurysm size. The diameter of an aneurysm plays a significant role in predicting the risk of rupture, with the risk rising markedly as the diameter of an aneurysm increases. According to a joint statement from the American Association for Vascular Surgery and the Society for Vascular Surgery, rupture risk based on abdominal aortic aneurysm diameter is 0% in aneurysms, less than 4.0 centimeters in diameter, and increasing up to 50% in aneurysms, 8.0 centimeters in diameter or greater, as described in this table. Next, expansion rate. The expansion rate may also be an important determinant of the risk of rupture. A small abdominal aortic aneurysm that expands 0.5 centimeters or more over 6 months of follow-up is considered to be at high risk for rupture. Lastly, other factors with potential risk for rupture are smoking, uncontrolled hypertension, and increased wall stress. Inflammatory aneurysm. Approximately 5% of abdominal aortic aneurysms were classified as inflammatory aneurysms, which are characterized by abdominal or back pain, tenderness on palpation, weight loss, and an elevated erythrocyte sedimentation rate. To avoid rupture, an abdominal aortic aneurysm should ideally be diagnosed prior to the onset of clinical symptoms. On standard physical examination, around 30% of asymptomatic abdominal aortic aneurysms are identified as a pulsatile abdominal mass. A pulsatile, expansile lump at or above the umbilicus may be discovered on physical examination. Abdominal auscultation should be performed as part of the vascular examination since the presence of a bruit may indicate aortic or visceral artery atherosclerotic disease, or, in rare cases, an aortocaval fistula, that is machinery murmur. If you find anything like this on a physical examination, get a USG immediately. Abdominal USG is considered the screening modality of choice for abdominal aortic aneurysms because of its high sensitivity of 95% to 100% and a specificity of nearly 100%, as well as its safety and relatively low cost. Next, CT scan of the abdomen. CT scanning evaluates the abdomen in more detail in patients with a specific abdominal complaint. It also assesses the shape of the aneurysm with more comprehensive anatomical details of the mesenteric and iliac arteries, and also provides better imaging of suprarenal aneurysms. Treatment depends on the location and size of your aneurysm. It also depends on the state of your health. If you have a small aneurysm, you may not need any treatment. Your healthcare provider will see you regularly to make sure your aneurysm isn't getting any bigger if you have a large growing aneurysm. If you have surgery, a strong graft material will replace the damaged area of your aorta. This may require open surgery, although sometimes you can't have a less invasive procedure called endovascular surgery. Your medical professional may prescribe medicines to control your blood pressure and heart rate. Controlling these two things may slow the growth of your aneurysm. You will likely have routine imaging tests to check the size of your aneurysm. Beta blockers. Although the data regarding the therapeutic benefit of beta blockers in the management of abdominal aneurysms are limited, beta blockers have been shown to significantly reduce the expansion rate of abdominal aneurysms when monitored by serial USG examination. Ruptured aneurysms and some aortic dissections require emergency surgery. Making healthy lifestyle changes can help prevent aneurysms from forming or getting worse. If you smoke, quit. Make sure you are eating a healthy diet. Talk with your healthcare provider about the right activity level for you and get active. Thanks for watching. Please subscribe and support us to learn more. Thank you.